Welcome to Kwaderno Academy, empowering excellence through education. Join us as we inspire growth and unleash your potential. Let's dive in.
Hey everyone, if you work in skilled nursing, you've probably heard the term Simple LTC thrown around. But what does it actually mean? Because it can feel like it means two totally different things. One's a clinical philosophy and the other's a data system. So today we're going to cut through the confusion and show you how to unite those two ideas into one single, powerful strategy. Let's get into it. Does this look familiar? I mean, let's be real. The day-to-day and long-term care can feel like you're just drowning in paperwork. You're fighting against regulatory burdens, dealing with communication breakdowns, and you're under this constant pressure to prove your value. It's a mountain of administrative tasks that pulls you away from the reason you got into this in the first place, your patients. All right, so here's our game plan. First, we'll talk about the core challenge we're all facing. Then we'll actually define Simple LTC. After that, we'll look at the two different sides of it, see how they come together right at the bedside, and then we'll wrap up with a solid action plan that you and your team can actually use. So let's start with the big challenge. The traditional way of doing things in a skilled nursing facility, or SNF, often means clinicians get absolutely buried in compliance and risk management. And look, that stuff is necessary, but it's not the same as providing that hands-on, functional treatment that really makes a difference. And that right there is the why behind this whole thing. The big goal is to completely flip that script. It's all about cutting down that administrative weight so that clinicians can finally get back to focusing their skills and their time where it matters most, directly with the patient. Okay, so what is Simple LTC? Well, the term actually stands for a really powerful two-part idea. It's not just one thing. Think of it as two different but totally complementary definitions that, when you bring them together, create a way more effective model for care. So on one side, you've got the clinical view. This is all about person-centered care, it's about functional independence, and it's about that crucial human collaboration between therapists, nurses, the whole team. Then on the other side, you have the systems view. This is the unified, data-driven platform that uses tech to make compliance simpler and to actually get ahead of quality issues. So let's see how these two sides really work together. So let's dig into these two sides of the coin a bit more. You have the human touch, which is all about collaboration and function. And then you have the data engine, which is all about predictive analytics and making things run smoothly. This table just lays it out perfectly, right? The old model is totally reactive. You're focused on just getting the paperwork done, and you only jump into action after a bad quality measure pops up. But in the data-driven model, the whole focus shifts. You're using real-time analytics to prevent those problems from ever happening. The entire team is united around one source of truth to boost those QMs and optimize for the patient-driven payment model, or PDPM. It's all about being proactive, not reactive. And here's the bottom line. All that data, all that tech, it has one single purpose. It's to make this happen right here. It's to make sure that the patient is always consistently working at their highest possible level. That data engine is there to serve the clinical goal, period. Okay, so this is where the rubber meets the road. How does this high-tech data engine actually empower the human touch right there at the bedside? Let's look at how it works in practice. First off, we've got to talk about the patient-driven payment model, PDPM. To put it simply, this model is what connects reimbursement to how complex a patient's needs actually are. So getting your data and documentation right doesn't just check a box for regulators. It justifies the money you need for proper staffing and for truly individualized therapy. Now let's see how this plays out in a real workflow. So the data system flags a patient with a high risk for falls. Bam, that's the trigger. The whole interdisciplinary team gets together and sets one unified goal. Then a therapist actually trains the CNAs on that specific transfer technique. The nurses document that this new technique is being carried over 24/7. And what's the result? The data shows a measurable drop in falls. The technology kicked off a perfectly coordinated human response. And this really shows that the data is only as good as the follow-through, This system only works because of these human-centered actions. It needs therapists directly training CNAs. It needs standardized equipment. It needs nurses who encourage a culture of patient independence. This consistent, round-the-clock reinforcement of therapy goals, that's the carryover. That's the secret sauce that makes the data actually mean something. So how do you make this happen in your own facility? Let's break it down into a really clear, unified action plan, role by role. Okay, for the nurses out there, your role is to be the engine of data quality. And this is not just more paperwork. It's about painting an accurate clinical picture of your patient. Prioritizing correct ICD-10 codes and complete MDS documentation is what fuels the entire system. It ensures you get the right reimbursement and the right risk analysis. But even better, it lets you use predictive analytics, so you can shift from just reacting to problems to actually preventing them, all while using smart software to get back precious time for patient care. And for our therapists, your mission is to use this data to justify and elevate the skilled care you provide. You want to draw a clear line from every single intervention back to a complex diagnosis. It's about documenting outcomes in a way that directly boosts those quality measures, proving the incredible value you bring. This data-informed approach also lets you be more flexible, using analytics to guide the best treatment modes and making sure every minute of therapy counts towards the patient's progress. You know, this brings us back to what might be the most powerful idea in this whole model. The success of the entire system, everything we've talked about, it all hinges on carryover. It's that commitment from everyone, therapists, nurses, CNAs, to weave those therapy goals into every single hour of the patient's day. That right there is the bridge between the data and the human touch. So in the end, Simple LTC isn't about choosing between a high-touch clinical model or a high-tech data model. The real win, the true success, happens when the technology serves and amplifies human collaboration, making it easier for everybody to do their absolute best work for the patient. And that leaves us with one final question to think about. Back at your own facility, is your data actually working for your team, making care more intuitive and effective? Or does it feel like your team is just working to feed a data machine? The answer to that question is really the key to unlocking a simpler and much more powerful approach to long-term care. Thanks for tuning in.
Brought to you by Kwaderno KO. Learn smarter, not harder.